relapsed refractory mantle cell lymphoma is a rapidly evolving field in a good way, with a bunch of new targeted therapies and novel therapies, including cellular therapy, entering our treatment options. So typically the most important choice when someone comes in with relapsed mantle cell lymphoma is, what did they get in the front line and how long was their remission? So if I had a patient that had chemoimmunotherapy and transplant and enjoyed a 10-year remission, that's a different patient than if we had a patient who got chemoimmunotherapy and is basically relapsing while they're on their maintenance Rituxan. So let's say a higher risk relapse, or really any relapse, the standard of care is to consider usually targeted therapies. That includes BTK, Bruton tyrosine kinase inhibitors. There's emerging data looking at venetoclax in this group of patients. Lenalidomide with rituximab is another potential option. Bortezomib-based therapies are also used here, though falling a little further in terms of the preference list now that we have BTK inhibitors and such. And then patients who have had several relapses, what I think is the most exciting in that space is anti-CD19 CAR T-cell therapy. So there's been some recent data looking at CD19 CAR T in patients that have relapsed mantle cell lymphoma who are resistant or refractory to BTK inhibitor, with very high overall response rate and about 2/3 of patients achieving complete responses that seem durable. So as more data emerge there, hopefully that'll be another thing that becomes standardly available outside of clinical trial for our relapsed patients.